Kei te whakakotahi mai, mo te whakarewatanga o Tiriwā.
I'd still be lost ever since they've come on board. It's like I've found a backbone in my life. They've become that to me, very, very strong in their mahi and especially their awhi towards people.
I whakarewa i te tōpūtanga o Tiwana ki Ōtautahi i te kaupapa o Tiriwā. He pūnaha ipurangi hei tautoko i ngā whānau Māori kia whaiwhai haere i ngā ratonga Hauora. E ai ki tetahi o ngā kaiwhakamahi i ngā ratonga a Kenneth Stevens, he nui ngā hua ka puta.
For those that don't know how to reach out, it's going to be another avenue for them to be able to reach out and look in through any media that they're able to, that it will suffice for them to come through.
We know we have providers, services, practitioners out there doing good mahi, and so this is about us giving them a platform in terms of whānau being able to access their information.
Ko tā te kai hautu o Tiwana me te kai whakahaere o Tiriwā a Manakalei, he nui ngā kiritaki ka haere ki a rātou mai te hohipera. Ko tā rātou kia whakaki i ngā whāwhārua kia pai te anga whakamua.
We've been working very closely with our secondary care teams, so the Hauora Māori teams within the hospital settings. And what we're finding is that whānau, when they switch between secondary care and primary care, they're falling through the cracks, not getting picked up in the community in time and bouncing back into the hospital.
Pai ngā kare aroto, ki te mōhio, ki reira tētahi, kapa e rere ana ki te hāpai ki te manaaki i tō taua iwi Māori.
Ina nei e tae ana te hapori kia tomo ki te pūnaha ipurangi kia whai tautoko ki ngā ratonga kei Ōtautahi. Ko tā lei, i roa te whakaora i te kaupapa, engari nā te whakarewatanga, kua tau te wairua.
We've been in pilot phase for about 3 months with just a few small groups, key stakeholders. What's next is continuing to review and refine what we're doing, evaluating our services. We're hoping to grow the team a little bit in the next couple of months, so that's exciting. We're hoping that this can be another spark within that space for us to work together. That's what it's going to take.
It's something that needs to be pulled together for Māori as a collective, and I think that's what we need more and more of. We don't have enough of it at the moment.
Ko te tūmanako ia, ka puta ngā hua i hiahia nei e rātou, a ka whiwhi ngā whānau i te tautoko e matawara ana. Halle Taite-Pitama, Tahu News.
Ko te reo, te take.